So your question's a good one. I'm not trying to skirt around the idea of what is good exercise. I don't even know the answer. I still think 20 to 30 minutes of getting your heart rate up to 60%, 70% of your maximum predicted, consistent. People are all, about weight loss, looking at these interval training and go fast and slow down, go fast and slow down. I have no idea. Yeah, it works to lose weight. I have no idea what it does for, I think the slow, steady, slow and steady, moderate, do your stuff, do it consistently, is going to get your heart protection where it needs to be because it trains the muscles. Whether or not you lose weight with it, that's a whole different story about interval training and muscle training and all that stuff.
As far as maximum heart rate goes, like when you're exercising, is there, in addition to this calculation 220 minus your age, that takes into account your resting heart rate? I mean, somebody that starts out at 50, if they get to 100, that's pretty good. But if you're at 80 beats per minute,
that's a good question. I'm not going to say I don't know the answer to that. That's a good question. And we actually, unfortunately, in our population, we mitigate where your heart rate can go with some of the medications we use. We're putting a governor on the engine. It's basically everybody who's ever rented a U-Haul truck and goes out on the interstate tries to go over 55. You can't just stop yourself. That's what your heart rate's doing when you're on a beta blocker, for instance. And so a lot of our patients are people on beta blockers for high blood pressure, for heart problems, heart failure, things like that. So we're not artificially, we're absolutely controlling what your heart rate can do. And so you might start at 50, you may never get to 100. Those kinds of people, if you really push it, you're going to feel that because your body's saying, my God, I need more heart rate. And it's not getting there, and all of a sudden the legs start burning, the blood pressure drops. So you're going to get to that point a little sooner. And I don't know what to tell you about training of the heart with a low heart rate. It's a great question, and I'd be happy to look into that. But it's a very good question. I've never heard anybody even ask that before, but it's interesting. We will put people occasionally on a treadmill to make sure their heart rates can get up, especially if they're dizzy, lightheaded, you don't know why they're passing out, to make sure they're what's called chronotropically and competent, meaning that they can get their heart rate up. Chronotrope means fast heart rate, or getting the heart rate up over time. So it's a good question. Athletes that run in the 40s seem to have pretty good competence and also health. So low heart rate isn't a bad thing, but normally we don't see people who have heart rates in the 40s and 50s resting. They can't get them up to what they should get up unless we're holding back, or you have some electrical issue with the heart.
so if you have a 30-year-old with a resting heart rate of 40, they can get up to like 180, 190.
They should be able to.
Easily.
Yeah, they should be able to. I was telling, Karen's our physician assistant in our office, Karen Hummus, so if you guys haven't met her before, but we were talking today about this. I generally run a pretty low heart rate, at least when I was younger and healthier. And they put me on a treadmill when I was a fellow at Duke, and did the whole thing, closing off the nose, measuring the oxygen, and painful. And I went, close to 20 minutes on a Bruce protocol, which about killed me. And I got my heart rate to 200. And 220 minus my age at that point was 180, 185. And so, yeah, you can push it, you'll get it there. But it's just you don't have to be there daily because your muscles don't need it. You're trained. You have trained muscles. And that's what activity does for your heart. It doesn't improve your heart function necessarily. It just makes your heart's life easier. It doesn't have to get the oxygen places it doesn't need to. You have a very efficient system, so you don't need as much oxygen or blood pressure to get it there. So that's what, if you have a heart muscle where the squeezing function is half of what it should be, I can't get it any better with exercise, but I can get you feeling a whole lot better with exercise because your heart muscle is just a muscle. And if it doesn't have to squeeze hard, it's fine. It's love and life, and because your muscles are taking care of it. You can train other muscles, you can't train your heart. necessarily. If you've had heart damage, you can't train the heart muscle to get better. We have medications that can help that, but you can't make your heart muscle stronger with exercise necessarily. It makes it more efficient, so it essentially is stronger, but that's what it's doing. The number may stay exactly the same, the squeezing function, but you feel 10 times better because your muscles are able to take it. So. Yes.
What impact does sleep have, or lack of?
More is, some is good, more is better. That's a good one. I think the biggest thing that we see with sleep is not so much the duration of sleep, but the quality of sleep. And so many people, I'm just amazed, and I don't even want to get tested myself for sleep apnea. I'm saying, but you see people with sleep disorders where they don't get into deep REM sleep, and some of it's because they're having, either central sleep apnea or obstructive sleep apnea, where they're not getting into that because all of a sudden the oxygen saturations come down, and then all of a sudden you arouse because you don't have the oxygen, or the carbon dioxide starts building up, and then you sort of come out of a snoring fit, and you just, all of a sudden you just start back again, and you never get into that deep sleep. Well, it's not so much the sleep, but it's what the oxygen decrease is doing on lung function, increasing pulmonary pressures, increasing the chance of sudden cardiac death, things like that. So I don't know the answer, I'll be honest with you, just about plain old sleep. If you have great sleep function and you just don't get it, I don't know. It's a good question too.
More importantly, is the myth of red wine true?
Is the what? If you like it.
Please say yes.
I hope it is.
So here.
I'm telling my wife, by the way, that technically curious.
If you don't learn anything tonight, every curve looks like this. This is mortality with no alcohol, this is moderate, and this is high. So you want to be at the bottom part of this wine glass. And wherever you draw your levels to is fine. Yes, red wine.
Dark chocolate too?
In dark chocolate? There's some, there's a lot of stuff out there, I think, that is not necessarily been medically proven, but some of it has, and the Mediterranean diets and the dark chocolates and the small to moderate red wines versus white wines. There is something. It's been debunked. I'm just blanking completely on the chemical. Resveratrol. So that was supposedly the thing. If you took it, you had the greatest. You could be Moses. 600 years from now. And there was a guy at UPMC that still believes in it, and he runs his marathons in Hawaii and does his and he's a neurosurgeon at UPMC, a guy named Maroon, who believes in this, has a company that sold this to the masses. And I saw a recent trial in the last year that basically said, randomized trial didn't show any difference. Red wine's good though. It gives you peacefulness.
Serenity.
It does help HDL. Again, alcohol in general does help HDL moderate levels. Talking about 1 to 2 glasses, and when my dad comes to town, I hide the big glasses because when he pours his wine, he pours it to the top. That's a half a bottle on that. So whatever glass we're talking about still moderate levels. 1 to 2 drinks, maybe a day, help HDL. But some people don't even know if it's good HDL. When you start looking at those VAP profiles, sometimes the HDL goes up and it's not the good stuff. It's just you're masking, feeling good about your ratios. And the ratios aren't necessarily appropriate, so they're not reflective of what's going on in the body. So, good red wine. It's not the cheap stuff. questions, anything? Doesn't have to do with, it could be about bad hearts, electrical problems, anything, nothing, pacemakers, anything.
I thought I history of Raynaud's.
Yes,
Is that, I had an incident 10 years ago where I touched a cold, in the middle of the winter, and I felt electrical shock, like
Huh.
a doorknob, and it felt like there was ice, like in my veins. And I was diagnosed with ductal impairment, like basically doing a procedure. I was put on medicine for that winter, and then I was told to go off of it, and I've never had to take it since.
that's interesting. You weren't smoking anything at the time? I mean, right now, it doesn't have to happen with smoking, but it's people are very sensitive to the cold. You get all of a sudden your fingertips turn white, purple, red, all of a sudden, you get reperfusion, and it's from vasospasm. And it's more common in people that smoke, but you don't have to smoke to have it for sure. Whether or not it's related to, some people believe it can be related to birth control, ups and downs of progesterone and estrogen in women tends to be more common in women than it is in men. It can come and go. It can come and never be a problem. Some people have such severe problems with it that it's not life-threatening, but it's life-changing. You can't go anywhere without gloves on and we have medications to dilate the arteries, which are the calcium channel blockers typically. Sometimes we use the nitrates, but things like norvasc, ranolidipine, diltiazem, verapamil, those are used. And some people that have Raynaud's get coronary vasospasm too. We were talking about that a little bit earlier. Can you get spasm of one of the vessels? And so people that have migraines, Raynaud's, coronary spasm, migraines are from spasm in the arteries in the brain. You get the spasm, you get the funny little things in front of your eyes because and some people can have stroke-like symptoms. All of a sudden your body says, whoa, dilate that, it does, and you get this booming headache that just incapacitates you. So that's a migraine. It can go along with Raynaud's, it can go along with vasospasm. It tends to be more common with the other things, especially the coronary vasospasm, female smokers, which that's not the case. And why you had it, and it went away.
I just wondered if I should be concerned down the road with my heart.
It's not necessarily related to coronary disease or blockages in blood vessels. In fact, most of the time it's not. If you have coronary vasospasm, almost always it's because there's a blockage there that it could be a 20% blockage. But your natural vasodilators, we all produce nitric oxide in the walls of the vessels. There's something called prostacyclin that is in the walls of the vessels. If you take aspirin, it reduces your platelets from making prostacyclin, so you can actually promote vasospasm by taking aspirin. And people that are prone to it with Raynaud's and whatnot, beta blockers can promote Raynaud's. So if you're on any of the beta blockers for any other reason, we usually try to switch you off of those for that. It usually doesn't correlate so much with coronary disease, especially if it just came and went. I don't know how to explain it, but yes.
I have a daughter, she gets severe migraines. Is there anything that you think of that you can do?
Well, migraines are a whole different thing because there are lots of different causes of migraines and treatments for migraines. And whether or not you have the classic migraine, whether or not it really is migraine, it's cluster headaches, there's all different kinds of things that get classified as migraines. The classic migraine is caused by a spasm in an artery in your head that releases, and now you have the pounding head. As far as the heart goes, there's one association. There's a phenomenon where people have a hole in their heart. It's called a patent foramen ovale. Okay, so before you're born, there's a little trap door that's open. You allow blood flow to go from the right side to the left side. It doesn't have to go through your lungs. You don't need oxygen in utero. As soon as you're born, that trap door closes because the pressures increase on the right side or the left side of the heart. Some people, that trap door is still open. And so there's an association with having that hole and migraines. And in fact, they did a trial over in Europe that looked at closing that hole in people with migraine headaches, classic migraines. This stuff first, it's called scintillating scotoma. It starts as this kind of wavy line that goes across your vision. That's the spasm to your optic arteries and stuff in the back of your head. And then you get this rush of blood that causes the 3-hour headache after. So what they did was they closed people's holes and found that 60% of people that had classic migraines actually had significant reduction or complete cessation of their migraines. And the idea is that your bowel produces, or the liver, or who knows what, produces serotonin. Serotonin is a vasospastic drug that would normally go to your lungs and get metabolized. The theory is at least it can cross over this hole, go to the head, cause spasm, and basically starts the classic migraine. So 60% of patients that had their holes closed didn't have migraines anymore, significant reduction. They tried a trial in the US. We were involved with it at Allegheny General. The problem was you had to meet such strict criteria to get into the trial. You had to have so many episodes a month. You had to fail 3 meds. You had to be, and so they couldn't get enough patients enrolled in it. So it never got finished in the US. So closing that hole is not something that we're able to do. I can tell you selfishly, I had classic migraines. I never got the headaches, I just got the weird stuff. And I had a huge hole in my heart. And about 8 years ago, I had it closed, and I haven't had but 2 since then. I used to have them once a week. I'd be in the middle of doing heart caths, and all of a sudden I get this stuff. And okay, maybe not the time. We're into it. Just give me 5 minutes. We're okay. And I've had literally 2 since then, 2 or 3 since then. But whether or not that's placebo, I could care less. It worked for me. I don't care. But that's the only association with migraines in the heart. Other migraines, you know, they come in all shapes and forms, migraines. And some people get diagnosed with migraines, not really migraines. It's very specific definitions of them. But treatment of migraines, sometimes people use beta blockers to sort of relax the blood vessels. Sometimes people use calcium channel blockers to prevent that initial spasm and then relaxation. I'm not a migraine guy, but the neurologists have pretty
But you
strict
could have
definitions.
an operation because it's not approved.
Well, you have to have the hole, number one.